Mente Abierta, trabajo colaborativo en Comunicaciones.
In some issues, without service provision, it's very difficult to make a change. Taking, for example, maternal health. If you're suggesting to women who are about to give birth that they must go to a health centre, well, obviously it's very important that there are health centres. It's important that health centres are working well, that there are trained staff there, etc. So there are some issues in which service provision is really key. Having said that, with every issue, you really want to be able to do education, because these pregnant women aren't going to know how incredibly important it is to have a trained birth assistant unless they hear about it on the radio or see about it, find out about it on TV, or they hear about it through interpersonal communication. So I'd say that with virtually every health issue, there is a huge influence of education and communications. To address that, you really need to get people talking and for communities to have common understanding. And that's why one of the really good approaches for kind of closed communities or small communities or villages is to have discussion groups so that these issues are talked about openly and that the community reaches, to the degree possible, a common understanding of what the health issue is, what the preventative actions are, and to agree a way forward, which hopefully would involve very little cost and perhaps just changes of attitude and then some small changes of behavior. What we have now are ICT tools, communications tools, such as interactive voice response, where you can give out a simple phone number, either a free phone number or a regular number, and ask people to call and then give them information over the phone. And that gets over major problems you've had in the past of, for example, security, which, I mean, we still have that in northern Nigeria, in Afghanistan, in many countries, where it is really very difficult to go to certain places. So now using mobile communications, anybody with a mobile phone and a little bit of credit can make a call. And they could get a lot of information that way, whether they've heard a radio program or not. Also using the same system, interactive voice response, we can reach out to people. We can call out to them so that they hear a message and then they make some choices, press 1, press 2, press 3, and find out about specific issues that they have. The most interesting part, and something that we're in the process of trying to test right now, is that we believe that we are getting more honest answers by using this IVR system than we do in face-to-face discussions. When you're talking about very difficult issues, for example, intimate partner violence, gender-based violence, and when we compare it to the discussions that happen in face-to-face with either the couple or as a small group, we believe that the responses we're getting to that from the IVR system are probably more honest, and they're certainly very able to talk about very difficult issues. For those changes where the need is a change of attitude or where knowledge needs to be imparted which didn't exist before, then your changes have a good chance of being sustainable. Where you have less chance of being sustainable is where funding is constantly required, or service delivery needs to keep going and needs to be very good quality. Now, on the other hand, there are a lot of changes which are very sustainable simply by improving knowledge, changing knowledge, leading to changes in attitudes. And occasionally that change in attitude will be enough to make a big difference in health of the community.